I know we're all having a great time, but we'll have to have more fun after. We'll have call this HHS meeting together, please. We will now, the first agenda item will be the Pledge of Allegiance thing.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I need a motion to adopt the agenda.
Romano adopts the agenda.
Second, Hall.
Is there any discussion? So we have Commissioner Romano with the motion, and I'm not sure who was first. Commissioner Wallace supports. Thank you. We will vote. I need a motion for the minutes, please.
So moved by
Thank you. Is there any discussion? The motion was submitted by Commissioner Nard and supported by Commissioner Farrington, and we can vote on that, please.
Motion passes 12-0.
Thank you. This is now public opinion for anything that is on our agenda. Is there anybody in the public who would like to speak for 3 minutes? Nobody in the public to speak? Thank you. We will close public participation at this time and go to presentations. Kevin from Martha T. Berry. Hello there. Glad you're here.
I am too. Thank you. Happy holidays to everybody. I hope you enjoyed Thanksgiving. We have a lot to be thankful for. I'm going to be talking just about 7.5 minutes today. If you have questions after that, that's great. But I want to talk a little bit about history for some of those that were here. I do want to talk a little bit about the millage conversation, but not a lot of time on that. And then we could talk about the financials that we have in quality to put your minds at ease on what we're doing moving forward. I want to talk about 30 seconds about our foundation and its success. And then the longest part of the conversation will be about vaccinations, because there's a lot going on with that. And I want you to know what we're doing and why we're doing what we're doing and how it's keeping people safe. First is, and some people might already know this, but Public Act 280 was established in 1939 to help counties work on social welfare programs for those that are indigent and in need at various levels. Under Public Act 280, Martha T. Berry at the time was a hospital. Prior to that, it was a poor farm. And it is set for as a social safety net for those that are medically frail and indigent. It worked for a lot of ways, and this commission was incredibly supportive over many years, in some years giving as much as $4 million in a year to help subsidize that. That was not necessary, and this commission knew that. They stopped doing that, I think, around 2009 or so. In 2000, however, they did a building fund bond to expand. They didn't completely do what needed to be done at the time, because the building at the time was, roughly 40 years old. In talking with the then administrator, she said, "I did what I thought we could get through." So I don't think she had the same kind of relationship that we have, with the commissioners, because we've been very, very transparent in a lot of things, and our conversations have been direct, not always happy on one end or the other, but it has been direct and respectful, and I appreciate that with all of you. So in 2009, there was also unrest and a lot of change in what happened as far as the structure of the county goes, and a number of lawsuits actually were filed between the facility and the county against each other to try and say who's responsible for this. The long and short of it, the courts found that Public Act 280 was the one to look at and established that the Department of Health and Human Services Board, that two of whom are appointed by you and one appointed by the governor or his or her agent, is responsible for running the facility. In light of that transition that they wanted to have, there were two agreements that were put in place. One was a joint operating agreement that actually had the unions working together with the county commissioners and the executive office, which was essentially a one-year agreement that established the transition of power or responsibility. The second was the building use agreement, which was a 20-year program, which is up next year. And what it did was lay out the terms of how the building is going to be used by Martha T. Berry. That's the one that I refer to when I say we're being double dipped right now, and we will be. So we're essentially, we paid for the bond, we paid for it, we don't get a chance to pay for, we don't get a chance to benefit from the depreciation, and we're continuing to pay for our repairs. So we're paying rent, and we're also doing our own repairs. But that building use agreement is up next year, and we need to renegotiate that. I just want you to know that I'll have to begin that. Have no idea how that's going to work in terms of the process with the commissioners and with the executive office. So we're going to have that conversation pretty readily as to what my hopes are in transition or not. Okay. Conversation about the millage. There were some things that were said the last time. I want to clarify because they were inaccurate. When I came to this to the board in 2018, July 2018, I brought the concern that I had that we'd have a pinch point financially in July, and that was with this HHS board. And we talked about it many, many months. But if you want to see a great summary of it, it's in the 10/30/19 HHS board video that you can find online, where we said, hey, we've come to it. I won't go into all the things that we tried to do, but we rested there. And I said I would need a 0.1 mil millage, which again, Public Act 280 allows this board to do. And I said I may need the second half, it would be a 0.05 mil millage, but I don't know that, all right? I never said that it would take care of all of my problems. I did say that if both of them were, I was confident that that would take care of the cash flow issues, all right? So then COVID hit, and we are going through a number of radical changes in terms of process and communication and requirements put upon us. And in the middle of that, you had to approve a budget that I had included that 0.5 mil millage, and that was voted down. And I understand that. I'm disappointed, but I understand it. I asked the county commissioner or the county executive for some money on some things that we needed to do not from the general fund, but for their building for the seniors here in terms of HVAC. And they said that there's no more money coming our way with those new funds. So in that $1 billion budget, I was told no from the county exec's office. Disappointed, but I understand. This is a huge responsibility that you all have, and I will do my best. And this is what I'm doing in terms of my best. All right. I am reissuing a budget to the exec's office, and you'll see a copy of it too when it comes out. That'll essentially have us losing money next year. I recognize that this is not an appropriations budget. All right. It's impossible to lose money in an appropriations budget, and I'm sure you all understand that. We're an enterprise budget, which means we have to look year over year on what our business is going to be. And I'm looking at probably about $430,000 loss next year. I believe financially we can bear that burden as we cash smooth, and one of the ways I'll be doing that is I'll be looking at all the ways that I can pay people to make sure that we have good relationships in the community. But there are some of the bills that come to the county that I might have to slow pay to make sure we have cash smoothing. I shared that with you. That's one of the things I would be doing, and just be aware of it. We have outstanding quality. I just want you to know we've already bumped up another point in our quality measures. We're trending to go from a 3 to a 4-star in our quality measures this year, which I'm incredibly proud of our team. And that's unusual during COVID. If you take a look at all the trending numbers, you'll see that we're trending up where many of the facilities are trending down. We have lost some people, but we haven't lost as many as others. And if you take a look at us compared to the county, which I just received, the separation is even greater in terms of the number of people that they've lost. So you look at that and you look at how many people are just leaving the labor force, and it's really quite concerning. And a lot of it has to do with the vaccinations. We'll get to that in a minute. I do want to say that we had an outstanding foundation event, the best ever. We netted $45,000, and we were able to buy, one of the things we were able to buy that was incredibly important is lift chairs. Some residents aren't able to lift themselves out, and they need help getting out, so they have to wait for a staff member. They have to ring the bell, and then they have to come and help them. But with the lift chairs, they've become much more independent. They just need that little help. It helps stand them up. They can straighten up, grab their walker. It's just tremendous. If you understand when you're starting to get more and more debilitated, a little tool like that is expensive makes a huge difference. So I'm pretty excited about that. Now on to vaccines. It was mandated, and then it wasn't, then it was, and then it wasn't, and now it's not. A stay was put on it for all health care for the nation, and I believe it's the right thing to do. In my view, the vaccine mandate was flawed in that it didn't address the key issues. They believe that long-term care is the most at risk because that's the only place that they actually have real data on. If you're intellectually honest about this, you recognize if they scrutinized Walmart in the same way that they did SNFs and not, instead of SNFs, they went to Walmart and said, okay, we're going to test everybody that comes in and out of your building twice a week, and if we find positives there, we're going to test you even more. And you would have Walmarts all across the country being the hot spots, but they didn't do that. The only place they have actual real data is in nursing homes because it's the only place they can compel it regulatorily. So we're continuing to test twice a week, all those that are unvaccinated. When the vaccine mandate came out, my staff, actually I had 14 of them say, you know, December 5th is going to be our last day, Kevin. Some of us are going to retire early, some of us are just going to quit. There's a lot of things that can help support them, and they're fully aware of it, that there's a lot of systems in place that can support them for up to a year of being unemployed. And they said, this is just too much stress. And I said, please stay with me. And I was able to talk a few of them into it, but it wasn't until the vaccine mandate was put on hold that the rest of them said, okay, we're going to take a breath. So I think I still will lose 2 that just said, you know, it's just too much. I don't want to go through this, but I won't have a loss of 14 like I expected to. That being said, we're still in the top 5% in staffing levels in the state and nation, not because we're doing great. We certainly have less than what we want, but we're not as bad as the rest of the county, state, and nation. All right, and that is my 6.5-minute review.
Kevin, is there anything else that you would like to say?
Well, I want to thank the commission for years. When there were dark days in 2009, the commission was the group that actually helped support and keep us alive. I am truly disappointed in the millage, but I think it was a number of things. I think there were some new people that didn't understand what was happening at Martha T. Berry, and I think some really don't believe in caring for seniors here in that way. And I understand that we all have different philosophies. All right. My job is to serve this community to the best of my ability and to ask the questions even if they're difficult. I asked that question. You all said no, and I thank you for listening to me. I thank you for the discourse. But I do want to be clear, at no time would I ever be untruthful to you. And if I say my yes is yes, it's going to be yes. And I never one time said, give me that once and it'll be fine. Right? But what's gone is gone. And my focus is to move forward, right? So thank you again for the support over the years. Thank you for the support on the first millage. And I'll do my best to make sure that the seniors in your districts are well cared for.
But I don't think, Kevin, that people don't want to take care of seniors. I think there were other factors that people were thinking about. That would be my thought. Up here to speak to you is Commissioner Kraft, please.
Thank you, Madam Chair. Kevin, as always, I want to thank you for your passion, your dedication, and being direct, open, and transparent with us. I feel from this end of the table that we can have those conversations with you as well. And thank you for, reworking the plan after what happened. I have a question for you about the HVAC system. Do you have any sort of estimate as to how much that cost would be?
Oh, yeah. What we really need are the rooftop units, the RTUs, to be replaced and upgraded with new technology, and both in cleaning and in monitoring. That would cost about 1.3, and then to 1.6, depending on who you're talking to. All right, and those are rough numbers because people right now don't want to give you a firm quote. Okay.
Sure.
Then we have what's called the P-TECs. Those are the personal wall-mounted ones that we have to have. So you need the large system, and then you need individual in-room areas that could talk to each other. And we need over 200 of those because they don't make what we have in the building anymore. So they have to be custom made, and that's going to be another 1.3 to 1.5. We actually were able to get some better pricing on that. So the total would be just under $3 million for everything. But if I could get the RTUs, that would be huge in any budget. So if there's any crumbs left over from the $1 billion, I would really welcome somebody to throw a couple our way. I'd be most grateful.
And none of that includes the $430K loss, right? This is separate from.
This is all separate, yes.
Just, okay.
Yeah.
I'm trying to get the actual number in my head.
So let me tell you how I'll be working it. Let's assume that there's no help coming from the county and there's no money coming here. I have to pay off my responsibilities on the front of the house, and I might have to slow pay that. It might take 18 months to get that done. After that, I can begin what they call funding depreciation, which most people know of as a sinking fund. That's an allowable expense that Medicaid allows me to take as long as it's directed towards furnishings, fixtures, or the physical plant, right? So I can put that money in the bank, but it'll take me probably 2.5 to 3.5 years to save up that money. And I also have a number of elevators that were original equipment in there. It's the old Frankenstein, you can hear it actually chunking when it connects. I have those in the building right now. So, and those will cost somewhere around $800,000 a piece too. But I was hoping that some of the money that was coming from infrastructure and some from the CARES Act could help us kind of get a jump start on that physical plant. All right, but we've done a lot of work in the infrastructure, so I know that we can kind of tap the brakes on new things until we get this taken care of.
Okay. Thank you, Kevin.
You're
Thank you,
welcome.
Madam Chair.
Thank you, Commissioner. Commissioner Sabatini, please.
Thank you, Chair. Thank you, Kevin, for the history and clarifying everything. I was here 10 years ago and left, and obviously in 18, whatever happened. Whatever that misunderstanding was in regards to what I guess I was told or assumed. But just kind of going back to when you started off today, you talked about the joint agreement that you believe is for 1 year. And then in regards to the building itself, which that expires this year.
End of next year.
End of next year,
Mm-hmm.
Okay. So you're saying that you do not or are unable to depreciate the building relative to MTB being, let's say, the tenant there under your current agreement?
Actually, no. It's just a bookkeeping issue. What happened? This was prior to me, according to Jeff Ostermeyer from Plant Moran, that when the county was looking to try and balance some books, and it's the county's facility,
Right.
they were trying to balance the books operationally, and this is a paper expense, right? So they asked to move the depreciation from the books at Martha T. Berry back to the county books. So at that point, it came back over here. And we get a small portion of that through the Maximus, but we don't have the full ability to depreciate that. So I'm hoping that we can get that back. And once our building use is paid off, we can use that to help fund the depreciation, because we are still entirely responsible for that building.
Right. So you're saying after next year, that's when that would then be able to be done, where you're able to depreciate.
Well, once I pay off the building use, which is essentially the amount of the bond, the 20-year bond for the improvements on the front of the building.
Okay. And then do you have a capital
improvement plan or fund or anything? in
Well,
regards
I
to-
have a plan, but I have no fund. That's the issue right now.
Okay.
So that, when COVID hit, we had to put all of our resources in that. And so the discussion I was having is, if I can get a jump start on this, then I can start putting that sinking fund together for this. My goal, God willing and the board willing, I'll be here another 9 years, and I hope to have, a $3 or $4 million sinking fund for the next administrator, and have some of these things that are on my checklist done before I leave.
So your budget that you're operating under is simply for the operations of the facility?
Yeah, and some
And you're
small,
trying,
and some,
but you're trying to do everything with that budget?
yeah, well, I have to, so, and I did, again, the finance department helped us short-term, when they refinanced the OPEB, it was a short-term help, but a long-term hurt, all right? They actually increased our expenses. This was back in 2016, when I first got here. Took me a while to figure out that they had, when they refinanced it, they only allowed us to expense it, the state allowed us to expense that refinance for only 3 years. And I could have refinanced it every year for 20 years if I had just paid for it myself. But they thought it was a good thing for cash smoothing's sake, because they looked at it as if it was an appropriations budget, not realizing that they just killed us from a reimbursement standpoint. So short-term was really helpful, but long-term, it was bad.
Got it. Okay, thank you so much. Thank you, Madam Chair.
Commissioner Farrington, please.
Thank you, Madam Chair. Kevin, welcome. Over the past year, I've gained a lot of respect for you and what you've done there. But I can't let past the two comments you made. One that the chair lightly hit on that I'm going to be a little more forceful about. But you said that the new commissioners really didn't understand what they were doing with Martha T. Berry. I take that personally. You said that some members of this committee, do not believe in the value of taking care of the elderly. I will never forget you said that, because I think that was not only erroneous, it was spiteful, and I just wanted to be a little more forceful than our chair was. So, thank you.
Well, Commissioner Farrington, I apologize. That was not my intent. My intent was that there are some that don't believe that the county should be involved in senior care. That's a philosophy that some have, and it made it quite clear to me. And if you're not that person, then...
With respect to the sheriff, I can comment. That's a totally different comment. That is not what you said. You said people on this commission, some don't care about the elderly. Those were your words, sir.
Then please forgive me. That was not my intent.
I'm glad you clarified that.
Right, yeah. And thank you for bringing it up, because that was never my intent.
You've done a great job over the year I've met you,
thank
and I
you.
appreciate the quality that's improved there. Philosophically, we differ on the millage, and I hope that you can make it all work with what you got, and maybe we can come up with another way, but thank you.
Well, thank you. And again, if there's anything that does offend anyone here, please bring it to my attention, because it's never my intent to offend. And trying to get a full conversation in 6.5 minutes sometimes, clearly I misspoke. So thank you for correcting me on that.
Kevin, were you told you had 6.5 minutes?
No, I always do that because I want to make sure that I'm somewhat verbose.
Okay, thank you.
If you know Ron White, who says, I have the right to remain silent, just not the ability.
Okay.
That would be me. So I can try and over-educate, so I intentionally limit myself, and I practice the conversation and the intent so that I do not, the last thing I want to do is solve someone's insomnia while I'm here.
Well, that's good. I'm getting good at using the gavel now. Commissioner Song, please.
Thank you, Madam Chair. And I also want to say thank you for touching on that too, Commissioner Farrington. I appreciate your presentation and all the information that you have provided us. As a new commissioner, we are still learning this process, but what you did say about us not caring about seniors or the elderly is not true, and that is someone who's actually caring for someone who is an elderly, disabled relative. I find that very offensive. So thank you so much, Commissioner Farrington, for bringing that up.
Yeah, and please forgive me, Commissioner Song. It certainly was, I misspoke. Again, just to be clear, I would never accuse someone of not caring for seniors. What I intended to say was that there are some on the board that have told me just directly that they don't believe that the county should be in the business of caring for seniors through Martha T. Berry. So, so I said right after that, and I understand, and respect those opinions. I thought I said that. Maybe I just said it in my own head. But so please know that I'm not here to offend people. I'm not here to drop a mic. We all have to be here, serving the public, and certainly this is a very tense, can be very tense. And my goal is to just help with knowledge, but certainly never bring drama to it. So again,
Thank you, Madam
I'm sorry.
Chair.
Thank you. I know when I speak to Kevin before the meetings, he's always, how can I want to say this in a way that the commissioners will be able to understand, and I never want to offend the commissioners, so I can tell you he never wants to offend, so we all make mistakes.
And clearly sometimes I don't succeed in that.
We
please
all
forgive
make
me.
mistakes.
Please forgive me.
Also, congratulations specifically on your 4-star quality rating. That's marvelous,
Yes.
especially at this time. That's really wonderful. And I know you always give the credit to your workers, and we are very, very thankful for your workers. Please tell them we know how hard it is, and we appreciate it. And I also need a motion to receive and file, please.
You have Commissioner Romano.
So moved. Receive and file.
Support
Commissioner
Farrington.
Romano, receive and file motion, and Farrington, support. Thank you very much, Kevin, and have a great Christmas, because we
Thank
won't
you.
see you then.
Thanks to all.
No, you were.
Motion passes 12-0.
That was like stereo.
Laura Rios, can you come up for Veterans Services, please? And can I have a motion for receive and file?
So move. Commissioner
Support.
Song.
Commissioner Song makes the motion. Commissioner Nard supports. Thank you. Laura, what would you like to say?
Well, this presentation is about my third quarter statistical data, and it's been postponed a few times, so it's late in this quarter that we're giving last quarters. But just to touch on a few things that I wanted to bring up. So the campaign was running the last time we met, and I know you want, and you're very intuitive about our media campaign. So I wanted just to, I had some deep dive statistical data, and then I kind of summarized it. So prior to our campaign, we had about 1,685 hits to our website. During that 4-week campaign, it went up to 20,049 hits in a 4-week period. So I'm not doing the math, but that's a lot. It's probably like 1,000%, So it's big. So having people visit my website gets them information, but having people call me and set up an appointment gets me one step closer to getting their benefits for them. So we try to do our best and track that, and county IT does that for us. So unfortunately, they didn't give the specific dates from prior to the campaign and during the campaign. So they gave me the month, and my campaign pretty much ran half of one month and half of another month. But I saw about maybe 100 more in that 1 month period. So it wasn't huge, like 1,000 times better, but at least we're getting there. And our numbers for our phones are increasing daily. So we are seeing that. Well, plus it's open enrollment. So with open enrollment, people want to ask about their VA healthcare benefits because, can I opt out of Medicare Part A and B? They want to know if they can have this or that. So we do get a lot of calls for that. Some of the other things I wanted to mention after listening to my friend over at Martha T. Berry was our veterans home, which is just up the street in Chesterfield. It's not fully staffed. They have now a waiting list of veterans needing to get in there. And why it's not fully staffed is because there's a nurse shortage. So they can't get more residents, even though they have plenty that want to move there. They have to have the nurses per the ratio of how many clients or customers that they have. So I feel for him and his shortage of employees because our veterans home, which is state-of-the-art, beautiful, now we're on a waiting list to get in there. So another statistic that I wanted to bring up was the demographics of who kind of watched our ads and I don't know how they do all of this, but they are our media company. She wasn't available today to come, but they had some great statistics. Our video was viewed 67,000 times, with over 22% of people watched the entire video. The demographics is 45 to 54 years of age range, and also 65 and older years range, and 65 plus had the highest engagement. So they watched the video, they clicked on the clicks, which surprises me because I don't see a lot of them, well, especially my World War II veterans that are in the 90s being very tech savvy. But the other thing, both men and women contribute to the engagement. Men usually had more total engagements, but women had more higher engagement rate. So I'm like, oh yeah. It could be the spouses kicking the veteran to go get their benefits, or it could, like, I'm not telling you something you don't know, right? Or it could be the female veterans, looking for engagement, more information. So those are just some of the statistical data that I wanted to bring up. We are very busy with our PTSD evaluations, our hearing loss evaluations, and our financial coaching. So as things were kind of dormant last year because of higher restrictions of COVID and people not wanting to get out of their house, people are now at least understanding healthcare is important and getting their healthcare and getting their disability ratings. So that's my 6 minutes. I like Kevin. So,
Commissioner Song, please.
Thank you, Madam Chair. Laura, I just wanted to say thank you for helping one of the veterans that I met last month. I know he was a little difficult to work with and rough around the edges, but I really appreciate you guys reaching out to him and taking care of him. So thank you for that.
Oh, you're welcome.
And thank you for this presentation too, as well. I was looking at page 1, and you mentioned 2 million. So I think there might be a typo at the bottom right there where it says social media ads were shown.
Oh, 2 million?
Yeah, 2 million and not 2,000 point.
Actually, it's 2 million.
2 million, yes. I realized that when I looked at the next page. So, yeah, I think that information is, really important to be able to see, the ROI. So thank you for sharing that with us.
I mean, if I'm going to spend money, I want to see results. And granted, I keep track of how much somebody gets in retro. I keep track on winning appeals. I keep track of claims. But obviously, not every person is equal. I mean, my disabilities aren't the same disabilities somebody else had. And and everything's based on the individual records. But I will tell you, that's not on here because I just won it since October. I just won an appeal that went back 11 years, and he received $350,000 from the VA. That was a hard job for me. It was a hard job to keep him motivated to I'm going to quit. I'm going to quit. I'm like, we don't quit. We fight until the judge makes a decision. And if the judge keeps remanding it for more evidence or more opinions, then we roll with it. And it was trying to keep him engaged and I took his initial claim in 2000, and I want to say 2009, 2010, because it was right around the end of 2009. So I kept him very engaged, and, he's just seen the tears in his eye, because now it's life-changing.
Thank you so much.
Thank you, Laura.
Thanks.
Thank you.
Thank you, Chair.
Thank you. Thank you.
You're welcome.
Thank you, Laura.
Thank you. Thank you and your people. Commissioner Romano.
Thank you, Chair. Hi, Laura.
Oh, hi.
You all right?
I'm good. I was
Okay.
like, where are you?
You are good. No,
You're behind
you
your-
are-
you're
you
behind
are
your
good.
computer.
Your institution is good, and you're doing a great job. My question is simple. How do you obtain the names of people who were in the military or currently in the military? Do you have a database, or is it through the Secretary of State? Macomb County's pretty big, so how do you get a hold of your veterans? I mean,
I don't.
They have to get a hold of you.
Exactly.
And the communication that you send out, as you mentioned, the PR stuff that you send out is how they do get a hold of you. But is there some way from the, I don't know, I'm asking the Secretary, like, for example, I went to Secretary of State, and I got my license, and it says veteran on it, and I'm just wondering if how many, I don't know if the people here on the board understand the difficulty, and I'm not going to put myself in that category, but I'll put down the active veterans or veterans who have seen real active duty, Afghanistan, Desert Storm, realize the benefits that are available to them. But I'm just, and I know you reach out to us as much as you can, but I wonder if there isn't more that we can do to notify these vets. Well, I was in my 60s before I realized I had a benefit coming, in my 60s before I realized I had a benefit coming from and that was by chance because I happened to be at the senior center in Sterling Heights and got a hold of one of the liaisons that was there making small talk. And as you said, the VA is, once you apply for a benefit, they're like an army tank, if you can picture that plods along and it just continually goes and goes and goes, and eventually it'll reach its destination. They're not a gimme place. You've got to have a true disability before they'll even, before they realize that or they'll accept it. But once they do, as you said, this veteran that you helped out, I mean, how many more are out there that don't realize? And I'm just wondering, how else can we contact them? Going to your website is great. Try that from a guy from Vietnam area that doesn't know how to turn on the computer. It ain't going to happen.
Right.
So,
I agree.
So, as
That's
I
why
said,
we
is
need
there
more
some way
than
that
that.
we could get, would the Secretary of State give
So
us
let me explain
Go
that
ahead.
process. So the Secretary of State, when a veteran wants to identify themselves as veteran, brings their 214, gets their new driver's license updated, that data does go to MVAA, which is Michigan Veterans Affairs Agency. Michigan Veterans Affairs Agency sends them out a letter. They also run the 1-800-MISHVET. So they do their own advertising and they do their own campaigning, and at a state level, they also run the trust fund and they do some other things. We do get leads from them, I will tell you. So if somebody calls there and says, hey, I want to do this, they'll send them back to us. So is it every single day and flowing like 100 people a day? Oh, no. But how many people, there's so many people that just don't want to identify themselves as a veteran, and because they were angry or they were told that they couldn't get anything when they got out 50 years ago.
Yep.
And things have changed. So like anything, I have to have multiple ways of contacting everybody. I have to have multiple ways of, door to door would be great, but how many people would live in Macomb? Like 1 million? So that's not practical. Now, can I get a list of veterans that live in my county from the VA? All right, but what about the widows? So what about the active duty?
Can't do
VA
it.
doesn't have that. So when you get a list, and then I did inquire, and I did get a list, and then they said you had to sign an agreement that you can't do anything with it. So I can send a letter out to 50,000, and I got this list probably 6-7 years ago. But the manpower to send a letter out to every single person, I don't have that manpower. So I thought, okay, let's come up with another way of advertising. I will tell you, our outreach is probably our outreach and our word of mouth. So when I get to do events like the Clinton Township Taste of the Senses, Clinton Township just knows how to do it right. I mean, they get their advertising, so many people will just come there. We've done the Sterling Heights, I want to call it was like a beer fest or something. It was a big,
That's how I got a hold of you.
a couple years ago, at their big festival. So we try to do those. We try to do outreaches. We try to reach out to the senior services departments in all the townships. And I have probably 6 or 7 locations. We go to Romeo once a month. We go to Shelby Township, Romeo, Washington Township. We do go to the senior center in Sterling Heights. We just haven't had appointments. We have been to Warren at the South Action Center. We would sit at his office down in Warren. And we try to get into those locations. So the other thing that helped us is for the low income, the people that actually go to DHHS for benefits, we actually had a referral form. So if someone goes over there, they need to come see us. Because if you're asking for food stamps and state benefits and you need this and you want Medicaid, you need to come check us out to see if you can get a greater benefit. It's not to do any harm to the veteran. And we started that process back in 2011. And it went on that, well, we still have the partnership, but we did a pilot program. here, and it ran for about 4 years, and we collected the data to see how many people, how many veterans did actually benefit because they went there first and came to us, and then we got them disability or pension. So.
Great job, Laura. I just, as I say, sometimes it gets a little frustrating when you're a veteran and you have to go through the
Exactly.
hoops, as they say.
As
But
her
the end
veteran
result,
did.
but the end result is well worth it. But great job. Thank you so
And-
much.
And I will tell you, I will spend most of my time explaining the process and trying to de-aggravate somebody. And because the person that I got referred to about almost like 4 weeks ago, was just angry.
Exactly.
An angry person. And I'm like, well, let me prove to you that I am here to help you. Now, you could be angry at people that worked in my office 20 years ago, and I wasn't here. And nobody in my office was here 20 years ago. So let me show you this new process, and let me walk you through this process.
It does help that you're a veteran. Thanks, Laura.
So, thanks. Mhm.
Thank you, Commissioner. Commissioner Farrington, please.
Thank you, Chair. Laura, great job. I love seeing all the stats on the advertising. We do have an advertising expert right next to me here whose husband is a veteran. But anyways, the digital, so that's just the ad, right? And then they press the ad and it plays a video? Because I haven't received it on my computer that I live on 10 hours a day. So
Well, it was only a 4-week window.
still, what I'm trying to say is your firm that you're using is doing a great job of geofencing to find the people that are appropriate. So kudos to you picking them out. The direct mail, something I was just comment on it is you can purchase those lists as anyone that's run a campaign 12
We're looking
straight
at
years. You can purchase the veterans list and you can do a postcard, very inexpensive, where your staff doesn't really have to do any work.
And that's our plan for this
Yep.
coming year.
A very inexpensive way to
Yeah.
do it without your staff having to do individual letters or anything like that. My final question, though, was about the VITA or VITA program. Do you think you're going to have enough tax volunteers this year?
So my class is this Saturday. Would you like to come?
Not at all.
Would any of you like to learn some taxes? I'm
a
glad you
numbers
brought it
guy
up
that can't stand
there, Commissioner
taxes.
Farrington. I did a pretty good segue. Yeah. So I actually partner with Macomb Community Action. I run the program because I have over 20 years of tax experience, and I can't do it alone. So we definitely do it together, and some of his staff helped me do this. But I just did a $10,000 advertising campaign. Economic Development did some press releases. We, Senior Services sent out the information on their newsletter. And thank goodness, I have probably 30 or more people that are brand new that are interested. That will be there this Saturday. Now, my job is to get them to pass the test and stay. You know, it's one thing to be a greeter and greet people and be like a Walmart greeter, but it's another thing to prepare returns and get that test passed through the IRS. And that's my job. That's what I'm going to be working on. As I tell everybody, it's open book, open notes, open neighbor. That's how we pass our test. But no, it's open book tests, but it's really understanding the concepts. But I hope so. You sure you don't? I'm just, all right.
Thank you. Commissioner Matusek.
Thanks, Laura. I love the stats on the advertising.
Thank
'cause
you.
Really concerned we spend that advertising money wisely. So that was good to see. I just want to second what Jeff said and what we've talked about earlier. You got $400,000 coming in advertising next year. Spend part of that, hire a direct mail company, buy the veterans list, have them do a mailing. I mean, that's how we really get to folks who are not comfortable on the computer. And I think that would be a really great way to sort of boost our visibility out in the community. Even if they take that postcard and stick it on their desk with their pile of mail and get to it 6 months from now, the joy of direct mail is that people can set it aside, and when they need it, it's there, as opposed to the email, which once it sinks to the bottom of my screen, that's it for me. It's gone away. So I really appreciate the stats on the media campaign. That was very helpful. Thank you.
Thank you.
Thank you, Commissioner. Commissioner Hall?
Thank you. Hi, Laura.
Hi,
Are
sir.
you a 501c3 or C4?
No.
You're not.
I'm a county. I'm a county entity.
I was afraid of that.
So my VITA program is not even a 501. My VITA program, I tried to do the application for the IRS grant through our county, and the IRS approved it and then denied it because our county wasn't tax compliant about 2 years ago. You know, they missed a form and it was just a typo, but that stopped me from getting an IRS grant. So for the last couple of years, I've been going through United Way. And that's how I facilitate receiving the funds from the IRS to run that VITA program.
I'm glad to hear you say that. I'm the designee for Macomb County for the Southeastern
Yep.
United Way.
Mm-hmm.
And I know you sat through those Zoom meetings that lasted 4.5 hours. It's the most cumbersome, vetted process I've ever seen in my life, where you have to approve line item by line item to meet the federal government regulations. But one of the priorities we've established for 2023 is veterans, in addition to children and seniors and food centers, housing shelters. So if there's any way we can connect so that I can make sure those, Macomb County was just allocated $598,000 out of the 1.9 million. It's shared
From
between-
United Way.
Pardon me?
Is this from United Way?
Yes,
Okay,
in totality.
all right.
Because it's Oakland County, Wayne County, City of Detroit, and Macomb. So I'm looking for venues, and there's more. I think there was $2.9 million more ass than there was money. So, but I want to make sure Macomb County gets their share and we spend it on whatever needs are identified. So if there's any way we can connect on that, I'd be happy to talk to you.
Yep.
Thank you, Chair.
Thank you.
Thank you, Commissioner. Commissioner Van Sickle?
Thank you, Chair. Good afternoon, Laura.
There we are. Hi, sir.
I toured your facility out there in Chesterfield. It's a great facility, and it saddens me that you can't fill it.
Well, it's the employees they can't fill. And it's a state-run building. It's not run by the county. It's not run by the federal VA. It's a state-run building. And so those employees would be state employees.
I don't know what your policy is or you're enforcing with as far as vaccinated people, but if it's like Martha Teaberry, there's a lot of hospital workers who have walked away and might be looking for jobs because of the hospital mandates. On a second note, I live in Sterling Heights, and Sterling Heights has a very nice senior publication every 2 months. And I'm wondering if you might advertise in something like that. Being a veterans organization such as you are, I don't know if they'd give you a free ad, but I don't know anything about advertising in it. But the thought is also that other communities may have their own senior publications that they send out. And those also, as Commissioner Matusik hinted with direct mail, people tend to keep those and leaf through them because they have a lot of local activities in them. And it might be a good place for seniors to see information about you. Just a thought.
I like that thought. Thank you.
You're welcome. Thank you, Chair.
Yes, that would be very interesting if anyone had personal connections with their areas. That would be very interesting. You don't
I'm
really
actually
need
sure-
a lot of information. I mean, you just
Right.
need, we'll help veterans, veterans helping veterans, your phone number and your email, right?
I'm sure Senior Services, the Office of Senior Services, probably has all the information and contacts to all the
Yeah.
senior services in all the townships and cities. So
Right.
I'll go across the hall.
I,
Check it out.
I think we spoke about this before, but I'm not sure since you've been here. I was able to, I got a ticket and I went to Selfridge Air National Guard Base. And our our veterans group there. I was able to be with them. Laura received a national award for all she had done. It was a beautiful award. And there was another, who was the other person?
So it's a state award. It's at the state level.
it's a
And
state.
it was, so I have one employee, Katie, in my office, and Katie Carroll, and she was the Trust Fund Agent of the Year. And Trust Fund is the emergency grant that is for veterans and their families. And she won that award at the state level. We won the most veteran-friendly county of the year. Pat Daniels brought that award a few weeks ago when you nominated the Veteran of the Year. And so I was humbled to go up and get it, but now we have the bragging rights that we are the best in the state.
Yeah, well,
So-
I think I thought it was national because there was so much brass being there from everywhere. I met as many people as I could, and
That was a lot of state brass.
Well,
Yeah.
I thought there were some people from other states too, weren't there?
Yes, he was giving out the VA Employee of the Year award.
Yeah,
I mean, like the
it seemed
VA
like
award.
from wherever. Maybe they were originally from other places, of course, being in the service.
Yeah.
But it was beautiful. It was wonderful. It was very nice. And I think you had 10 employees there. Your 10
I
staff
did.
members.
We got 10 tickets.
Yes, and speaking to those our worker, they're
Yeah.
just wonderful. They explain exactly what they do, and I was so honored to be with them and so proud of them.
Thanks.
They're just
I'm
like
glad you-
Laura.
I'm
They
glad you
just-
came.
They just do a wonderful job for our people, and I'm just very proud of them. We all are proud of you.
Thank
And
you.
thank you very much for your tenacity and just being a force to be reckoned with and taking care of everybody. All right, I think we will take a vote.
I'll make the motion to receive and file.
I think we had that.
Yeah.
I think I remember to do that.
You did it at the
We
beginning.
did the motion.
Chair, I made the motion.
Yes, we did. All right, thank you, Laura, so much.
Thank you.
Okay. So I think we're now going to go to Ernest Callaway. Thank you. But I need a motion to recommend to full board.
So moved, Song.
Motion passes 11-0.
Okay, thank you very much. Ernest.
Thanks, Commissioners. This grant here is related to one you've already voted to receive, which is a Great Lakes Water Authority RAP program. The RAP program is a Water Residential Assistance Program. That's something we've been implementing around our region, both to help with water arrearages, as well as to go into homes and help prevent leakages. And this agreement specifically is for us to help out Oakland County as well. Our peer agency over in Oakland County has some staffing shortages with their weatherization. You may or may not know it, but we have, in my opinion, and others, the best weatherization program in the state. We have past precedent of lending out technical assistance across the state through our weatherization program. The parameters for Great Lakes Water Authority and RAP had changed in response to the pandemic. A lot of one-time funding coming down the pike. They wanted to make sure that the Southeast Michigan and Macomb County had the best flexibility to use these dollars. They knew that federal and state dollars were coming down for water, and they wanted to make sure we could use these in a complementary way. And so they altered the program, allowed us to do some new things, specifically with conservation, getting into homes, doing water repairs. In Oakland County, did not have the staff to do it. This contract is for us to help do that in Oakland County. We've already approved the contract for us to do it in our county.
Thank you for your explanation. Commissioner Song, please.
Thank you, Chair. Clarification, Ernest, this is just the program for Oakland County, or?
Yes,
Macomb, too.
that $201,000 is just the amount to cover, not the whole program, just the conservation program. They'll have their own allocation.
In Oakland County?
In Oakland County,
So none
yes.
of this will actually go to Macomb County
Uh,
households?
No, not the households, yes.
Okay, got it. Thank you. Probably not directly related to this one then, because it is Oakland County. My question is, how many households would this amount actually cover? And what about people that live in rental homes? Would it have to be the landlord or the homeowner to actually apply for this
We can go
as
into
opposed to the tenant?
We can go into a variety of homes. It all depends. With renters, to pay the arrearages off, the water would have to be in their name, right? And this is a low-income program for people 200% of the poverty line and below, right, to help out the most vulnerable in our county. So we can pay off your bills if the bills are in your name. A lot of renters don't have the water in their name. So with conservation and repairs, we can do it for renters. We can work that out with the landlords. And how many households depends on what we see. On average, maybe $500 a house, doing an assessment, some minor repairs. Sometimes we get into a house and we find leaks in the walls, in the basement, some flooding issues. It could be much more. Luckily, Macomb Community Action has a variety of resources. So we could pull from our minor home repair program or our weatherization program. Or we could reach out to Great Lakes Water Authority and ask for an exception to spend more money. But we are committed to keeping it at that $400 per unit average cost. That doesn't mean if we come to your house and you have a disaster, we can't spend a couple $1,000s. We just have to go for that low average.
Okay, thank you so much. Thank you, Chair.
Thank you. I think at this time we will take a vote.
Motion passes 12-0.
Thank you all.
Thank you. Director Cox?
Chair, I'll make a motion to forward this to full board.
Thank you. Commissioner Song has made the motion. Commissioner Nard supports. Thank you very much.
Good afternoon, Chair and Commissioners. Good to see you again.
Good to see you too. Thank you.
I'm here today with two agenda items. So we'll tackle the first one, which is the Wayne State University Physicians Group testing contract. This is a testing contract that was previously entered into with my predecessor, Bill Rodella, when we started testing back in July of 2020. And this testing program has been focused on offering testing. At one time, we were doing Sterling Heights as well as the City of Warren. Now it's just the City of Warren for 1 day a week for testing, PCR testing. The contract is needing to be extended to continue that service. We're actually seeing elevated numbers, unfortunately, in people utilizing those services. Typically, the last few months, we're averaging about 170 tests a month. So typically what you'll see is anywhere from 30 to 40 people getting tested a day. It's just 1 day a week. They do charge $100 a test for the PCR test, and they do have a setup fee for their vehicle, which is a mobile van. They set up at the City of Warren and work with them. And it seems like it's been well received and it's still needed. So we'd like to extend this contract until July of 2022 and reevaluate.
Commissioner Song?
Thank you, Chair. Andrew, is there a maximum or a minimum that has been spent already? Because this is a little unusual to bring forward a contract that is just based on, per kit, per day, right? So there's not like a dollar amount.
No, there's not a maximum. I can tell you in comparison, since July 1st, we've done 689 tests at this site. We do that about in 1 day at our Lakeside site, just under that. If you look at recent numbers, it shows you how much in comparison the testing numbers are. The testing numbers at this site are much smaller and lower. We do manage that and look at that, but there's not a cap.
Okay. Now, is there any plans to expand it to more days? And is the reason why, it's so much less than the Lakeside, is that the Lakeside open like every day?
So currently Lakeside is Monday, Wednesday, Fridays. It was at one point when we were at Baker 5 days a week. The numbers dropped down significantly, which is a good thing over the summer. So we reduced hours, we reduced days. So we dropped Tuesday, Thursdays. We have not gone back to 5 days a week yet. We're looking at that. Residents can still, there's a lot more testing options now than there was a year ago, and that's an important factor. Obviously, a lot of it is pharmacies, urgent cares are still doing quite a bit of testing. Plus, there's a big push. Tomorrow we're on a state call about an initiative for backpack testing that's going to send test kits, home test kits, the antigen, the rapid test to households potentially. So we're going to hear more about that tomorrow. So coupled with the PCR and the rapid test and the antigen test, there's just a lot more testing options that are more appropriate too than just using PCR for just everything. In my opinion, sometimes serial testing using PCR is not an appropriate, and it's very expensive as well. So I think that's where the rapid antigen tests are a lot more efficient and cost effective as well.
Mm-hmm. All right, thank you so much. Thank you, Chair.
Commissioner Matu, oh, I thought Commissioner Matusik was up there.
I was there, I'm just not there now. I don't know what
Are
happened.
you still there? Are you still here, though?
I don't see my name on the list, but
Still here.
Commissioner Matusik,
I am still
please.
here.
Thank you.
I want to follow up with that question. And I guess it's a broad question, but why do we need this?
Yeah,
I mean, one day
a
a week in Warren at $100 a test plus the cost of the van.
Sure.
And there are lots of places to get tests. I'm curious why we need this.
We rely very heavily on our partnership with the city of Warren, and they've advocated very strongly at the city there that not only their residents in that area, but also workers from the city of Warren rely on this testing site, because we did have a conversation of evaluating, do we continue testing? Because the numbers, especially in the summertime, were getting pretty low. And it was communicated to us very, very strongly that there's a testing presence needed in that area, that there are limited options for testing. And so we really wanted to work with our community partners and listen to them, and that's why we've kept it.
I guess I understand that. My question would be, if the city of Warren wants a testing center, why aren't they paying for a testing center? And what makes, again, you can get a test so many places. I mean, I always go to Lakeside because that's close to me, but
Yeah.
pharmacies all over the place. And there doesn't seem to be an upper limit on how much we're going to spend on this. I guess I don't see the need other than to make Warren happy, which I appreciate. But
in addition just to making Warren happy, in your own words,
yeah,
there is a need that we get from some residents that had difficulty with pharmacies, because a lot of them have gone to appointment-based testing where you have to make an appointment. And the need is to have a site where they can walk in. And the other thing is a lot of them are billing insurance. And that could be a barrier for some of our residents. This is, insurance is not required to come get tested either at our Lakeside site too. And so we continue to get feedback from the community that is a needed testing area. So that provides PCR too, because not every place is doing PCR testing. A lot of it is the rapid antigen test, which you probably are aware of. Mm-hmm. There is a need for PCR in a lot of cases, because we want to use that confirmatory test. It is the gold standard for testing. So in cases, the rapid antigens have become a lot more accurate in nature, but you can't replace that PCR test with a rapid antigen test. So we need that confirmatory diagnostic tool.
Does the county do any other testing in the South End?
We do
have
not.
Any testing
there is
sites?
A state testing site, I believe, in Roseville at All God's People Church that operates as well, but that is by the state.
Okay. Thank you, Madam Chair.
Thank you, Commissioner. Commissioner Hall, please.
Thank you, Chair. I can give you 3 examples right off the top of my head that have personally impacted my family in attempting to get testing. The place in Roseville, when I called on Tuesday, they said you can come in on Saturday. I went by the urgent care on 13 Mile and Little Mac. During the snowstorm on Sunday, the entire building was over capacity and there were 30 people standing in line with another 10 sitting in cars. My other grandson wanted to get tested on Wednesday. He called 48 places within a 1 hour radius of 21 Mile and Romeo Plank, and they told him he could come in on Saturday morning. So we're hearing there's a lot of testing facilities out there. Try to get into one. That's the problem that we're experiencing here, and any time we can minimize people not getting tested because they can't get an appointment or a facility, I wish we had another 20 of these vans driving around, specifically in Macomb County. So I'm all in favor of your agreement. And
Thank you, Commissioner.
anybody doesn't believe me, try calling up and getting a schedule for a test. Thank you.
Yeah, our helpline, we still operate our helpline 5 days a week, Monday through Friday, and staff that, and testing and where to get testing and availability of testing is still quite a bit, high percentage of our calls. So I can confirm what you just said.
Thank you, Commissioner. Commissioner Van Sickle, please.
Thank you. Good afternoon, Andrew.
Good afternoon.
There's no upper limit on this, correct?
Correct.
I can't support something that doesn't have an upper limit. Thank you.
In terms of upper limit, there's money. Yes, no. For money, there's not a set. You can only do 1,000 tests. However, the team that operates this, they only operate 9 to 2. It is limited hours, so there is only so much you could do in one day during that time frame with the team. And I can tell you that it's never, in the whole time since last July, ever exceeded what we would do in a day at our testing site. I know that's not a limit. But
I'd like to see the request have a limit to it, though, so that we know what we're dealing with. Thank you.
Commissioner Sabatini, please.
Thank you, Chair. Hi, Andrew. So some clarity here. So I may have misunderstood. So this is done 1 day a week, and where is it done again?
The City Hall.
At City Hall?
Yeah.
Okay. So that is what the City of Warren is publicizing on their website, that you can come into City Hall on Thursdays.
Correct.
And get the test. But we're paying for this cost, not the City of Warren.
That is correct.
Okay. So are there any other communities in the county that have expressed the same type of concern or would like to do the same type of program?
Not that I'm aware of.
Okay, so if my municipality would like to do the same type of program, they would have to go through the same channels in order to get that approved.
The channels being us. The request would
Correct.
come to us, and we would work with them. It doesn't have to go through Wayne State, obviously. So I just wanted to make that clarifying point. We don't have to go through the Wayne State Physicians Group, but we would try to either work with our state partners or other testing providers to try to get something in that community.
Because I do agree with Commissioner Batuzak. I think she makes a clear point. I mean, if her municipality wanted to get this in Clinton Township, there's a need. Obviously, Commissioner Hall and City of Roseville, there's a need everywhere. I think, the use of the Lakeside facility, I think, makes the most sense because we can get the most people there. It's a drive-through, and we can accommodate, the most. Obviously, getting out of your car, going into the City Hall, and at these costs, they seem a little high, obviously, but, I think there's a need, and I think what Commissioner Hall was saying in regards to, the demand, obviously there's a higher demand because there are more cases. Certainly we've experienced that in all of our communities, that if you can't find the appointment, you're just calling the next number to get that appointment. So I'm going to support this right now, but I need to think about this a little bit more before full board and make a few phone calls, but I'll move it on today. Thank you, Madam Chair.
Commissioner Farrington, please.
Thank you, Chair. Thanks, Andrew. Boy, my thoughts have been going like this as I hear each person speak. Yeah, the price is high, but over the last 20 weeks, we've seen the decimation that the virus has done. I'm a big believer in the vaccine, number one, testing, number two. I don't care about tracing, and I won't get into all the other debates. Is there a way to get more vans out there, at least in the short term? I mean, right now is when it's needed. Maybe in March, maybe in June, but we need them now. I mean, that's obvious, and he's not the only one that can give those examples. So I guess even though Warren has requested, perhaps we should go to the municipalities. Because it's not just Warren that might be low income. I mean, there are various areas, you know, throughout the community. So is there a way to put the boots on the ground, put the shots in the air, or this is the test, put the Q-tip up the nostril? Is there a way to do that in the short term?
There is. It's this fine balancing act of trying to provide services where they're needed, but also be mindful of funds. Most of the testing was provided through CARES Act dollars. That is pretty much
Can it be
running
taken
out
of the tracing funds that we approved?
No, and the state. This is the frustration that we had with the state. They said no to that.
Other than vaccines, I can't see anything that the county can do, and you might have examples that would be more pertinent to pushing back on this virus than this right here, or the Lakeside and all the other various ones that we're doing. So wherever you can get the funds, my personal perspective, I won't speak for the board, is as long as it's right now, not 2 months from now, not 3 months from now, I'll approve whatever you need for this. Thank you.
And Wayne State might have additional vans that we could utilize if there is a need, and municipalities would like that service. Right.
Well, I thought somebody different was up, but now we're going to have a party here. Commissioner Hall, please.
Thank you, Chair. When you say you can drive up and go get a test at Warren.
Point of order, Chair. I was wondering if the commissioners who haven't spoken could go first, and then we could do a second round.
Okay, mine's just for clarification.
Okay, thank you.
Now you did it, Maya. Now you did it, Maya. Mine's just for clarification. When you say you drive up to Warren and go up to the van and get tested, don't you need an appointment to do that?
No.
You can just walk up.
It's walk up. It's
there's
a
no
mobile
line
van.
or anything like that you're aware of?
I'm sorry, I didn't.
Is there a line when you walk up?
Not currently. You know,
Okay.
they're this
Good to
site.
know.
You know, they're able to get through them pretty quickly with
Thank
the
you.
numbers they're doing. So it's very
I
convenient.
have to hurry up and relinquish the floor
okay.
here. Thank you, Chair.
Commissioner Brown?
Madam Chair, I'd yield some of my time to my vice chair if he needs more time to speak.
Thank you, Chair, and I'm done.
All right, thank you. It's not a question of money. We've got the money. We've got so much money to fund this. This is not a question of the money. It's availability, and availability is still a serious issue. People are still scared out there. Last night, 5:30, I got a text from my good friend in Lapeer County. His daughter, 34 years old, died in his home yesterday. Died in his home. 3 hours later, she was doing fine, as far as he knew. 3 hours later, she was dead. This thing's still out there. It's unsettling. It's random. It's crazy. Anything we can do to help support getting vaccine out, we're all in, as was said by Commissioner Farrington, and everyone on the board wants to do the same thing. So, by all means, get it out there and do what we can. Do what's reasonable. Thank you.
Commissioner Song?
Thank you, Madam Chair. I don't remember us giving Commissioner Kraft a hard time when we were doing stuff for Chesterfield, so I don't know why we're still having this conversation. Not to put you on the spot, but I can say that the location of the van is a great prime spot, and you actually don't have to walk into City Hall. It's on the street, and there's adequate parking, and it's off of Van Dyke, so it's not on a busy street. So it is very ideal. I've seen it there all the time. So I think consistency is very important, especially since we have not seen, this pandemic, getting any better. So just to clarify regarding that, I would like to see more days because I think one day is certainly not enough, especially now that it is flu season and we're going into cold weather. I think it is very important to have it. So I fully support it, and I would support having additional days and in any other municipality as well. Thank you, Chair.
Chair, was Commissioner Song speaking prior to Commissioner
You
Nard and
set
Wallace?
precedence.
Okay, thank you.
I'm just going down the line. Everybody stay happy, happy, happy here. It's Christmas time. Commissioner Nard, please.
Thank you. Mr. Cox, you're doing a great job, I'm glad. To say that, I understand the cost is high, but the cost of life is much higher. And my grandson, his whole class got shut down because his teacher and 10 of the students came down with COVID. And to have those, just imagine if they all had to run way out to M59, to go get a test when they can just go right there to 12 Mile at Warren. So this is a good thing. I understand about the cost, but it's going to cost us a lot more if we start losing more people. And as this weather gets colder, we've just been blessed to have warmer weather, unusually warm, which I thank God for that. But when it gets colder, I'm quite sure those numbers are going to get higher. I've had 3 of my family members come down with it. A few of them have passed away with this. And this is a very difficult thing to see somebody a few hours, and then the next hour, you getting a call that they're not here anymore. So keep up the good work, and I'm glad about this. And as Commissioner Farrington said, I wish we could get this in more places. So thank you for your great work.
Commissioner.
Commissioner Wallace.
Thank you, Chair. I am trying to remember what I was going to say. I do know that I agreed with Commissioner Farrington, and just wondering, absolutely not trying to take anything away from Warren, but while we get the money together to use another van or another place to do testing, would it be possible, like you were able to do for the vaccines when it was like a weekend in Mount Clemens, and then I saw on social media you would be in a place in Sterling Heights on a certain weekend, just so people would know in advance, because it was all over social media. On this Saturday, you're going to be in Mount Clemens. On this Saturday, you're in Sterling Heights. On this Saturday, just so people know where to go. Because if I need to get tested, I may not need to get tested when you're in Mount Clemens, but at least I know when I'm not feeling right, I can go to Sterling Heights, or I can go to Warren, or wherever you had on social media.
Yeah, thanks, Commissioner. And we can absolutely do that. Our experience with testing is really what Commissioner Zong said. It is all about consistency and location and having that availability over and over. It's a little different from vaccines, where you come to a site and it's a one shot, and then you come back in 3 weeks somewhere else. Testing is, you're not planning to have COVID, and it just hits, and it's where can I get tested, and where is that site located? I shouldn't say everyone, a lot of people know about the Lakeside site, and then they also know about, the city of Warren residents. Obviously, they've done a great job of sharing that information. It's consistent. So those sites have been really more successful than the pop-up testing. Okay. And even the state has moved away from their pop-up testing as much as well for that factor.
Okay. That makes sense. I do believe you absolutely need a location in Warren, because someone that lives in Mount Clemens, it's easy for us to get to Lakeside. I mean, if I'm able to drop my kids off there every weekend, then I can definitely get there when I'm not feeling right. But like Commissioner Nard said, if you're coming from 8 Mile, it's going to be a little more difficult, especially if you're not feeling right. So I definitely agree with the locations, and right now I do think we need more, and I know you'll try to figure that out for us. I appreciate it. Thank you.
Thanks, Commissioner.
Commissioner Brown?
I'll pass.
Commissioner Farrington?
Thank you, Madam Chair. Is it possible, so if, without rereading it, it's 6 months, 1 van, 1 day? Is that what this is?
It's not hinged on just one van. We can add multiple vans. It would
Okay,
just
so
be
you can.
1,000 for each site
Okay.
setup.
Okay. That's why I want to make sure, because I'm like, if it's 1 van for 1 day for 6 months, I'd rather see 4 vans for 30 days, or 3 times a day, or it's right now is the need, so, okay. Thank you very much. Thank you, Madam Chair.
Commissioner Song?
Thank you so much, Madam Chair. I promise this is going to be the last time I speak. We should do more stuff in Warren, though. I did do the calculations really quickly. You said 689 tests since July, so that would have been 84,900 for a 4-month period with the $1,000 consideration. So just to kind of give you guys an idea. Thank you, Chair.
Thank you, Commissioner. Mr. Director, I have a couple, but listening to everybody, number one, before nobody was supposed to be packed into anybody, nobody was supposed to be close. So we're going into, well, we're past fall. Maybe we're still in fall, whatever, we're going into the cold season. So we know we're going to be having symptoms and all this stuff for the next few months because that's just the way it is in the cold weather. So I don't see one van. I don't see one van. I don't like the idea personally of one van going, it's going to be here and then here and here and here. I think if we're going to do that, there should be areas with vans at a set times and dates, or a special set days, set times for people to know where they're going to go. Is it possible to consider opening up areas with the tents or whatever? I mean, whatever it is, I think it should be set for the next few months, or for a month or so. Maybe the vans will be ideal at that time, just to make, people don't need to come from Warren to Mount Clements, and are they there today? I think that's too confusing. And when one of the commissioners said, well, the shot or the vaccine is the only thing we have. I disagree with that, to the point that in the beginning of all of this, they were saying there are supplements that can be taken. There are things that could be helped to boost the immune system. Some people know nothing about that, but that was advertised on the television. That was brought up regularly. We never hear that. Secondly, what is our lifestyle now versus, let's say, 50, 70 years ago? When someone was sick, they would be home. They were kept home. Now, if someone's got a runny nose, they're out. They're working, the children are out. Heaven forbid they would be staying home for a week or whatever it took. I had a brother-in-law, he was much older, and he, yes, even than me, and he was a physician in the Upper Peninsula. And he was a regular physician. He was actually a legend. And one of his sons, when my sister married him, she had 2 children with him, and I said, so when the one son was home in the winter for quite a while, and I said, is he still home? He said, yep. Jim said he's still sick, so he's home, and he won't be going to school until his symptoms are gone. I mean, we remember when we were little, if we were sick, if we didn't have the symptoms gone, we were home. That isn't the way our society is anymore. And that's what people should be thinking about, is our children should be home if they're sick. Adults should be home if they're sick. They're worried about their jobs, they're worried about paychecks, but that is how germs are spread. And that's how people don't get better. I think you would agree. People have to get better. They need to rest. They need to build up their immune system. Rest is one of the key factors. So I saw this on the CDC website. I said it was the CDC website. On the positive tests that I see when they're talking about it on the news, is this true? and you will know, I'm sure you will know. Number one, when you have a positive test, number one, it could be a false positive test. Nothing is accurate all the time. So we could have false. I don't know what that percentage is. I know people have had it, but I don't know what that percentage is. Number two, it could mean, if it's positive, that you have some immunity. Your immunity's building up. That's what it said. Could that possibly be true?
So that's a
Could
lot of
that show-
pressure that I'm going to know the answer to that, but
Okay.
I think I can share what I do know.
I have one more to ask you before you
Okay.
get into that,
Yeah,
please. Thank you so
yeah,
much.
yeah.
Number three, if it's positive, it means you could have had the SARS-CoV virus. So if you've had the virus, if you've been around people with it, your immune system's fighting it, could you be positive and not be symptomatic?
Excuse me, Chair, point of order. Kevin, are you a doctor?
I am not.
I think there's
Yes,
a
but he's
question that a medical person
but he's in
ought to
charge of the
answer.
health, he's in charge of the health department
He's
here.
not a doctor. You're asking him doctor. You're asking medical questions. He's not a doctor.
Well, he's the one who gets these reports and things. So do you have any information to that?
So I'll try to hit your 3 points. Is a test 100% accurate? No. None of the tests out there that are on the market are 100%
Right,
accurate.
I understand.
However, they are very highly accurate, and the chance of a false positive is very low, under 1%.
I would think so, yes.
The PCR is a more accurate test because it's looking at DNA, whereas the antigen is looking at the proteins of the virus. So the antigen test, or the rapid test, what we call, is still accurate. The accuracy is well above 90% for those rapid tests. They are very accurate. Are there times where they could have a false positive? Absolutely. In terms of what they're measuring, they're picking up the virus material. It does not necessarily mean that you're actively infectious. And that's where the symptoms come into play, and why we issue isolation guidance for individuals, because that has to do with the symptoms and picking up the virus. You asked, could you pick up the virus and be recovered? Absolutely you could,
Yeah.
because it's still in your system. It's not an indication all the time of how infectious you are. And oftentimes people have a hard time understanding that.
Yes. All right, thank you very much for those explanations.
Yeah.
I appreciate that very much. Commissioner Brown?
I'll pass.
All right, I think we will, at this time, take a vote.
Now you're under 20.
Motion passes 12-0.
Are you,
Madam Chair,
I
I
get a-
move make a motion to move to full board, item 7C, the budget amendment for the Health Department.
thank you, I was just.
Support by
Support.
Nard.
Commissioner Matusek moved and Commissioner Farrington supported. Thank you. Thank you, Commissioner. Andrew, please continue.
Thank you.
Thank you.
In this agenda item, I'm asking that you approve the amendment to change our CPBC grant agreement in the amount of $104,673. Within this amendment, there's 3 adjustments that the state is giving us. One is for the Children's Special Health Care Services Vaccine Initiative. This is going to be an initiative that we really use dollars to educate and reach out to families, specifically in the Children's Special Health Care Services that are most vulnerable for vaccines. This is not COVID vaccine. This is their childhood immunizations. As you probably have heard, our immunization rates took a real big hit because of COVID. We're very much trying to play catch up, and this money would be used for specifically these families within Children's Special Health Care Services. That amount of that initiative is $35,329. The next item is family planning in the amount of $19,344. This would be used to upgrade our Qualtrics system, to beef up the appointment system. Currently, they're using phone calls to book those appointments and book those over the phone. Qualtrics, which is the system that you all approved for us, in our effort to continue to use it and expand it like we promised. This is a great example of how we're going to do that. We've already done that with our flu appointments, but we're going to implement, hopefully, family planning into that program well with these dollars. Our last item is the local public health tracking, $50,000 for that item. This is a grant from the state that's given to us to basically make and help improve our environmental health programs, like our food service, to help make those inspections fully online. Currently, you get a portion of those food inspections online that you can see. This is going to help the scanning of those files and upload, and we're utilizing these funds to help roll out in concert with a new system, with that Acela system that we're implementing for our environmental health program. I'd be happy to take questions at this time.
There are no questions, so can we have a vote, please?
Motion passes 11-0.
Thank you very much. Thank you. Have a great Christmas. You too.
Chair, I'll make a motion to receive and file 8A and B.
Support.
Thank you. Commissioner Song made the motion for 8A and B, and Commissioner Romano supported. Take a vote on that, please. We are now going into public participation. Anyone from the public can speak for 3 minutes. Is there anyone who would like to speak? Could you say your name and your city, please? Thank you.
Yes, I am Rachel Eichhorst from Washington Township. I was actually hoping Director Cox was going to stay in the room. I've emailed him a few times and haven't received correspondence back, and I'm not sure if this is the appropriate audience for what I have to say today. And I don't expect interaction. I'm not sure how you do that with public comment, but I came here, was planning on coming here today to specifically talk about the discriminatory quarantine policies that we have in our schools, even though Macomb County has really done a great job compared to many surrounding us. Given the events of Tuesday afternoon, my thoughts have been a little bit all over the place. So I'm kind of address those two things, whether they're appropriate for this audience or not, and you can let me know afterwards. But like I said, I've directed these to Mr. Cox before and thought that he was part of this entire board. So I'm just going to share with you the email I sent to my local superintendent and school board to kind of give you an idea of where I'm coming from as they are taking direction from the Macomb County Health Department. This fall, there have been many vaccinated teachers out with COVID. Their children who attend our schools would certainly be considered a close contact, although in the situations we know personally, these students tested once and returned to school and continue to attend various functions. Meanwhile, families who are not vaccinated had to quarantine their healthy children, while the vax kids stayed in school and potentially spread to others in the meantime. One of those I know of this unvaccinated family was not symptomatic, tested negative, and was still sent home for 10 days. Never became sick. I understand that it is a recommendation of the Macomb County Health Department that our district is going with, like many of them are, but how long can we justify that? And keep in mind, this email, the audience is my school district, but I think it's relevant for this group as well. We test unvaxxed kids to collect data on them, but where is the data on the vaccinated individuals? Everybody I know, many right now who have COVID are all vaccinated. If we expect the community to take this seriously, then our schools should start tracking 3 groups. Who is getting sick that are previously vaccinated, who are getting sick that are unvaccinated and never had COVID, meaning they never had chance for natural antibodies. And the third group who is getting sick that are unvaccinated but did have COVID previously. Personally, I don't have a lot of faith in the narrative that, a lot of is guiding the topic of this in our country and our school districts. So I don't necessarily trust my school district to track those three groups accurately. But if we're going to continue with these arbitrary policies of quarantines, then I think tracking those three groups would be useful. And I also would like to think, not sure how much this group has control over this, but Macomb County in general. I study the quarantine numbers and the case numbers of my own district, let alone lots of districts around us. And just tracking the data even the last month, it is clear that even the districts that are masking, mandating masks, have more, in many cases, COVID cases than my own district does, or at least comparable numbers. So I think that's worth pointing out. I know there's a lot of controversy on either side, and I understand the tragic side of COVID, as I lost my mother this year to it. So I understand that there's a lot of debate over that, but I just want to commend Macomb County for giving parents choice. The other thing I want to discuss is vaccination clinics. To me, there is not a lack of access to the vaccine if you are eligible for it, but it does not belong in our schools. I am not sure if Macomb County Health Department is incentivizing our schools to hold these clinics. To me, I am much more concerned at the number of pediatric stroke and cardiac issues we are having since this vaccine is being promoted to our young people than I am about children
Excuse
getting
me.
COVID.
I can give you 20 more seconds,
That's
but you're
fine.
at the time. Okay, thank you very much.
In light of this week's events in Oxford, my shift is looking at how much money we are spending on COVID testing, and obviously that was very relevant to the last speaker. Is there any, and whether this group has control over it or not, discussion how any of those funds that are being given to us to handle COVID in our public schools, can they be allocated for school security? As I am sure many parents are more concerned about their child dying from a school shooting, even though I realize that that's still very rare, than we are about our kids dying from COVID, let alone having that be, the true threat that is in our schools. So whether this group is appropriate to bring that to you or not, those are my comments today. Thank you very much.
Just so you know, we don't respond to anybody. It's the public's time to talk. Thank you very much. We are now going to commissioners' comments. All right, please come up. Thank you very much for coming up.
I'm sorry, I didn't make it clear. I was waiting for you to ask again.
I'm very sorry. Thank you.
Thank you. Thank you for your time and attention. My name is Shelley, and I am a resident of Romeo, the village of Romeo. Just like Miss Rachel here, I came to think about COVID, to talk about COVID, to listen to what our health department had to present on it. And my focus was clinics in the schools and how that would impact our children having to listen to presentations or be encouraged and pushed and felt like if they didn't get the vaccine in school, they were going to be treated differently. And that shift for me as well has changed after the events of the other day. I started wondering, how much time, energy, and money is being spent on mental health related to COVID or not for our children. I too was hoping that the health department be present. We need to address mental health for our children in relation to COVID or anything. I would hope that as commissioners, you would think about that within your community and how are your children doing with mental health, and give the same amount of time that we gave to our senior services, our veteran services, and our potentially ill to our children. I'd love to come to another one of these meetings and see 20 minutes to a half hour to an hour spent talking about our children and our future and their mental health, their physical health, and not just when it comes to vaccines. So, thank you.
We will now be going to commissioner comments, please. Nobody? Commissioner Song?
Thank you, Madam Chair. So I don't know if you guys know, but a number of schools were closed today because of various misinformation on social media about threats. So that affected me very much because I do have 3 small children who are in elementary school. So when they woke up this morning, I didn't wake them up for school, but they woke up and they kind of knew that it was time to get ready to go to school. And I told them that the school was closed, and then they asked why. And I didn't know what to say to them because they are so very young. So I just told them that the teachers had to have a conference today. They had to talk, which was, partially true. But I just kind of want to put it out there and remind everyone that for us to, use social media with caution and not to share everything that we see, not to screenshot things from other apps and share it across social media because that travels so fast. So if anyone, does hear something or if they are threatened, that they talk to the appropriate authorities instead of sharing it on social media because that just does more harm. And, my children's future, is what is on the line here. So I just want to leave it at that. Thank you so much, Chair.
Thank you, Commissioner. Commissioner Kraft, please.
Thank you, Madam Chair. I want to commend our Community Mental Health Department, our director. As soon as the incident happened on Tuesday, they stepped up to offer any assistance necessary, any staff that could help. We were there, we were available, we're still there, we're still available. We have a Metro Region dinner tonight virtually with Oakland and Wayne County CMHs as well, their directors, staff, board members. And you can bet that this is going to be a topic of discussion as to how we can all work together within the mental health realm on possibly cutting these from happening in the future or deterring them from happening in the future. And we are also working with our director on what Commissioner Song said is just having these conversations with your kids. As a parent, just some quick tips, tricks, what to say, what not to say, and things like that. So we are working on some of those things to help parents and to help everybody in the community. And I'm just proud of our department and our director for stepping up in this awful time. So thank you, Madam Chair.
Commissioner Nard, please.
Yes, I just wanted to just kind of echo Commissioner Kraft and Commissioner Song. My grandson woke up this morning and he had seen the news last night. He didn't really understand what was going on, but his mother told me that when he got to school, he turned around and said, "So you think I'm gonna sit by a window today?" It just bothered me that he's worried that he has to be by a window because that's the way he can escape if somebody comes into school. So, and then the older grandkids were talking about, well, maybe the baby was bullied or whatever, and and I got a granddaughter that's 6 years old. She's being bullied in school, and I don't like the way it's being handled right now, so I'm going to address that later. But I just think we all just need to think about talking to our kids about bullying, talking to our kids about if something's going on with them. In my house, when I grew up, there were no locked doors. And there were no, your parents knew everything. You didn't have any business. And my father always would say, if you can't vote, you ain't got no business until you can vote and and pay for an apartment. That's the way it was. So when you have young kids, I just think we need to find out what they're doing and talk to them. And if they're looking different or saying something different, then ask the questions. Because, don't just allow them to be sad, because it's sad on both ends. A lot of us are, I'm upset about the kids that died, the kids that got shot, the teacher that got shot, but I'm also feeling sad for that young man, because what caused him to snap and do that type of thing. He just did it. And you don't wake up, every day and just say, hey, I'm going to go and just shoot up a school. There's got to be something that led up to that. And I just, I pray for that family as well as all the other families. And I just want us all to kind of step back, and if we have young kids and school-age kids, to think about that and just sit at the dinner table and talk to them about it. Thank you.
Thank you, commissioners. I know that Phil has a lot of knowledge with what those departments do. He's on them. He's very close with all of them. They're very great people in leadership there. I think that we can't let things like this take over our life. And some people will be glued to the news. I was switching over to something when I was eating, and it came on, and I couldn't change the channel fast enough. I don't want to hear about that. I want to live a positive, happy life, and especially with children. That was so wise. We have to lift our children up. They do not need to hear things like that. They need to be strong, and how they do that is by being secure. And we're seeing these situations, many of them are very much alike, and it's very sad. And but it doesn't mean that we have to be afraid. I think there are avenues of support, and we have police agencies and sheriff departments that we can talk to the leadership, and we can ask for help and dialogue. I just cannot give in to fear. I will not give in to fear. And as Macomb County citizens, we will not give in to fear. We will be strong. We will work through this. We will raise each other up. We will unify. We will love our children, and we will make our children strong and wise. And we will do whatever we can to help everyone we can. And that's the way we should be. And I hope the best for everybody and for the other counties too. It's a sad, terribly sad situation. But there are signs. Somebody told me, listening to Sheriff Bouchard, that several children did not want to go to school that day because they knew something was going to happen. And the sheriff said nobody called him. And I know when I was in Florida and that terrible situation happened there, we heard everything about that. And the superintendent of the principal of the school knew that boy was a problem, a situation. They knew that. And so we need to go to the agencies that can help the situation and not just let it happen. We need to be proactive, but not in fear, in wisdom. And if you don't have anyone else to call your commissioner. That's what we're here for. We'll figure it out for you. But we will not be afraid. We will take care of things. And I don't see any other speakers, so I think we will go to, someone could maybe go to adjournment.
Motion to adjourn.
Thank you very much, everyone. Who made the motion? Song made the motion, and Wallace supported it. Thank you.
Motion passes 11-0.